Hello, welcome to this webinar on the benefits of ACS membership. My name is Brian Frankel, and I'm the manager for international chapters at the American College of Surgeons. Also joining us today are two of my colleagues, Luke Moreau, who's the manager of domestic chapters, and Martha Zuniga, who's a chapter services program coordinator. If you have a question or comment throughout the webinar, please send those through the chat or Q&A functions at the bottom of your screen, and Luke and Martha will collect those as they come in. You may also select the icon to raise your hand, and we will call on you as time allows. If we are not able to address all the questions during the webinar, be assured that we'll follow up with you after. I would like now to introduce the panelist for our webinar. Corey Petty is the Senior Manager of Membership in the ACS Division of Member Services. She'll talk about some of the benefits of ACS membership. Karen Freeman is the Manager of Domestic and International Credentialing, and she'll talk about the fellowship application process. We're also pleased to have two ACS members who will describe their own membership journeys and how ACS has enhanced their surgical careers. Dr. Lindsay Kilgore is the RAS representative from the ACS Kansas chapter and a breast surgical oncologist at the University of Kansas Cancer Center. And Dr. Art Hiranyakas, he's the president of the ACS Thailand chapter and professor and director of colorectal surgery clinic at Bangkok Hospital. So welcome all of you, and thanks for joining us. And Dr. Kilgore will be joining us soon. So I'd now like to start the webinar by turning it over to Corey, and she'll talk about, again, the benefits of ACS membership. Corey?
Thank you, Brian. Good morning. I'm going to talk about primarily non-fellow membership. And so I'm going to start off talking about associate fellows. So the associate fellow category is a category for early career surgeons, primarily for people who do not yet meet the full criteria to become a fellow of the American College of Surgeons. For the application process, we ask for documentation that verifies that applicants have completed their surgical training. We also ask for information about licensure. So each associate fellow must have a current unrestricted license to practice, and they have to provide information about their current hospital and/or academic appointments. This category does not require board certification, but among the documents that we accept to verify completion of training, we do take board eligibility documents, board certification documents, or we provide a template that applicants can give to their residency program to give confirmation that they have completed training. And so the associate fellow category is really intended to help surgeons progress ultimately to the fellow level of membership. So as far as the benefits go, probably one of the main benefits is that membership provides a lot of opportunities for collaborating and networking with surgeons around the world. We have more than 100 chapters, including a large number of chapters in the US and internationally. I believe the last number that I saw was 130 countries have fellows and members of the American College of Surgeons. So membership provides a lot of benefits, particularly educational benefits and a lot of resources. There's a wide variety of webinars that are available. We have a surgeon well-being program that helps to address issues around burnout. There are a lot of quality improvement initiatives, and there are a lot of activities that help our members to develop their leadership skills. Membership also gives discounts on the many meetings and courses that the college offers. We give complimentary access to the Journal of the American College of Surgeons, which is our scientific publication, and to the ACS Bulletin, which is our monthly member magazine. Becoming a member also opens opportunities for being eligible to participate on committees and on different governance groups. And we have a lot of scholarships and fellowships that are only available to members of the organization. And finally, another benefit is that associate fellows who are current on their dues have their fellowship application fees waived when they're ready to apply to move up to that category. So in addition to the associate fellow group, among our non-fellow membership categories are the resident membership category, which helps surgical residents to start to become familiar with the wider world of surgery. We have a medical student category that provides a lot of information and resources for currently enrolled medical students, particularly those who do intend to pursue a career in surgery. And then we have an affiliate category that allows administrators and non-surgeon physicians and other healthcare professionals to join to get access to materials, information, networking opportunities that are going to help enhance the work that they do with surgeons, with surgical trainees, and with surgical patients. So what's the next step, if you're interested in joining, is to go to our website and review the requirements and then submit an online application. If you have questions, either while you're completing the application or before you go in to complete the application, there are several staff members that you can reach out to get assistance and information by email, or we have a toll-free phone line that's staffed during normal business hours. That concludes my presentation, and I'm going to hand it over to Karen.
Thank you, Corey. Good morning, everyone. I am going to spend the next few minutes to talk a little bit about our benefits of fellow. So I'll share my screen here. Okay, I hope everyone can see that. This year, we have over 65,000 fellows of the American College of Surgeons. This is the pinnacle of your surgical career in terms of gaining the ACS behind your name. This signifies that you have your education, your training, your professional qualifications, surgical competence, and ethical conduct have passed a rigorous evaluation with the American College of Surgeons. The FACS is designation as full membership, and you have access to all the benefits, plus having the opportunity to hold key leadership positions within the college. This year, we inducted a record of 2,350 new fellows, and the fellows represented the fellows that were represented were 1,274 from North America, which is our US and Canadian applicants. And then we have 1,076 represented over 84 international countries. The requirements to become a fellow are just slightly different for our North American applicants and our international applicants. Both must be certified. Our North American applicants must be certified by the American Surgical Specialty Board and the Osteopathic Surgical Specialty Board, or the specialty certification from the Royal College and Physicians of Canada. And we must have 1 year practice, a full and unrestricted license to practice in your state, a current hospital appointment, and the name of 3 ACS fellows for references. And you have to have 12 consecutive months of practice in one location. For our international requirements, of course, you have to be board certified in your country of origin. You need 3 years in independent practice before you apply, a full and unrestricted license to practice in your country, and a current hospital appointment, and of course, 3 ACS fellow references. You must also be in your one location for 12 months. It can take over a year for you to become a fellow, depending on when you submit your application. Here's our timeline and the published deadlines. I'll just quickly say December 1, 2021 is our both domestic and international application deadline. From there, we go to when we send your applications to our interview teams, when they receive the information, and then from March through May 15th, you go through the interviews, and then May 31st, all applications are due back. All interview reports are due back to ACS. This year, in 2022, we're planning to implement a rolling initiates process. This means that rather than having one deadline, December 1, and one interview cycle, which I talked about was from March to May, we'll implement 3 seasonal interview cycles to allow participants to become initiates throughout the year. These seasonal interview cycles will significantly reduce wait time from the fellow application process to the initiate status for the applicant. The interview process will become more manageable for our larger countries and allow more flexibilities as fewer applications will be spread out amongst the additional cycles. The annual convocation every year will still become you will still become a fellow at the annual clinical congress in October for all initiates. Now, these are not published dates. I just wanted to give you a snapshot of how we're going to do this year. In June, all of our applicants should have been interviewed by the Board of Regents. July 31st, we will notify everyone of their application status. And then, of course, the following in the natural course that we've been doing for years, we'll have from August through October, approved applicants will become initiates, and you can register to prepare for the clinical congress. In October, those who were approved by the Board of Regents will be conferred at clinical congress. Well, this year, we're also going to have that last group of applicants who will be interviewed by November 30th, and you will become an initiate at the end of 2022, and just wait for your conferment for 2023. So here I have, if you have any questions, you can always contact us. We have our credential analysts who I put their email addresses up here for you, and I am the manager. We also have a toll-free call. You can contact me through WhatsApp, and we have 2 different general emails for our domestic or North American fellows and our international fellows. So with that, I am going to stop my sharing, and thank you for your time.
Thanks, Karen, and thanks to you as well, Corey. Before we take questions at the end, I want to now turn it over to 2 ACS members to again share their journey as ACS members. First, I'd like to welcome Dr. Kilgore, who's going to talk about her path first as a resident and now as an ACS, as an associate fellow of the college. Dr. Kilgore, welcome.
Thank you all so much for having me. So I'm Lindsay Kilgore, and I'm a breast surgical oncologist at the University of Kansas Cancer Center. And I have been a member of ACS since I was a medical student, actually. So I joined in at the very beginning because I knew how important it was to be a member of the college, just because of mentors that I had had. You've heard it many times over and over already in just this short webinar about how wonderful the college is for networking and so many different resources. And so I just wanted to be able to tell you all that that truly is what the college is about. I have formed some great connections over the years, attending the meetings, attending the leadership and advocacy summit, getting involved in health policy and advocacy, as well as serving on different committees. I'm currently in my first, between my first and second year of practice, and I'm actually applying to be FACS right now. So I am an associate fellow. After you become a resident, you're in that associate fellow category before you become FACS, and I am the chair of the associate fellow committee. So I've been a part of the college since the beginning, and at every step along your career, there's a way that the college can help you. And like I said, not only with the connections, but also the resources. There are amazing resources on the college websites that I really hope you all will check out with regards to educational opportunities, other conferences that you can participate in. And even like I said, if you're interested in advocacy or health policy, there's ways to reach out and to get involved as well. I've conducted various interview series, and our first one will be published next on November 9th. If you want to look out for that, it's for pathways to fellowship and what being a member of the college means to different providers of all different subspecialties. So a lot of people think it needs to be general surgeons and general surgical subspecialties, but we actually focused on other surgical subspecialties as well. So why it's important even as a urologist, a neurosurgeon, a pediatric surgeon. So if you want to check out our webinars on that, that could be a great opportunity for you to hear from multiple people besides just me about why I think being a member is so important. So you can also follow us on Twitter at RASACS, and that's where we have a lot of our webinars posted, videos, and upcoming events. And it's a great way for you to see what we're involved in and then participate in things that spark your interest. So, I really do think the college has some wonderful things to offer people, regardless of where you are in your career, whether you're a student, a resident, a young attending, or late in your practice, you can still gain something from the college. And I really think membership is super important. So, I'm happy to answer any questions if things come up, if you have specific questions about what we're doing, but really the website has great resources, ways to get involved. And I know at times it can be daunting when you think about, well, how do I join this big organization and where should I start? Just find one thing. And from there, I promise you're going to find other things that really get you excited to be a member in the college.
Thank you, Dr. Kilgore. That was some really helpful information. We appreciate that. Dr. Hiranyakas, if we could turn to you and get your perspective as an international member and as a current fellow from Thailand, we would love to hear from you.
Thank you, Brian. So my journey started back in 2009 when I decided to join Cleveland Clinic in Western Florida, Professor Wexner, for my subspecialty training, colorectal surgery. It was a very wonderful experience working among surgeons and specialists in the US, in the States, and then making friends with other international and domestic, the States colleagues. And I think to become a member and a fellow of the ACS is extremely important to my career because at the end of the day, I graduated from the Cleveland Clinic in Florida, and then I moved back to my own country in 2011, and I started my practice as a colorectal surgeon specialist in Phuket, Thailand. I'm not sure if you guys know anything about Phuket, Thailand. Phuket is actually a very beautiful place, and lots of international people coming to these wonderful islands. And here I am working here with an international qualification. So it would make international patients and colleagues who would be coming to my service trust to the knowledge that I have and the practice that I would give to them. And it's nowadays, it's been around 10 years after my graduation from the States, and I have here a very busy practice. As you can see now in Thailand, it's 8:19 p.m. and I'm still working. Just done with my surgery half an hour ago. And then at the same time, not only the strong connection to around the whole world that I have with my previous colleagues and friends. At the same time, I love to continue my academic journeys as well. So we started with Dr. Wixner and the colleagues from the States to set up the International Colorectal Symposium in Phuket, started in 2013, and we do it biannually. And this year we would have a webinar of the International Colorectal Symposium next month in December. And I would like to share my screen for that as well. There we go. Right. So this is the 4th International Colorectal Disease Symposium. I'm not sure if you could see my slide. Oops, sorry. Here. It's going to be on December the 5th, 2021, from 8 to 10 a.m. Central Time. And we would be gathering all the famous and masterclass colorectal surgeons around the world, talking about controversies and hot topics in colorectal surgery. So we would welcome everybody to join us on the 5th of December this year. And that's it for my information, and I would be very happy to answer all the questions if you have. Thank you.
Thank you, Dr. Hiranyakar. We do have time for questions. Again, if you'd like to send them through the Q&A or the chat at the bottom, you can also click raise hand and we can enable you to talk, to ask your question for any of our panelists. We'll take those now. Corey, could you briefly describe like some of the elements of the membership process, some of the high level details for non-members out there? Do members have to join each year? Do they pay annual dues?
Yeah, so once someone becomes a member, they are billed for annual dues, and the dues must be paid in order to maintain the membership. We send out monthly notifications after the initial dues billing to give members opportunities throughout the calendar year to renew their membership.
Someone asked on the chat about the benefits, and so I don't know if we have specific emails that outline the benefits, but I would just recommend looking at the website. Someone also asked, are they able to join if they don't know other FACS members in the college?
I can answer that. They will have to know who are members of ACS. We have a find a surgeon tool on the website. They can look by location, by hospital, and 9 times out of 10, you'll find someone you really do know from a fellow. And also we ask that you can go to your chapter. If just go to the chapter, reach out to the chapter leaders, find out some networking opportunities, and get to know some people before you want to put in that application. Everybody's very open and willing to help you become a member.
Karen, when someone's completing the application, what are some tips or suggestions that you have? I guess, like, what are some of the things that your team sees that they really need to be aware of to make sure they complete or they get the information to us?
That's a great question. And a lot of things that we see are gaps in your professional activities. That's the biggest thing, that we find is someone will start their application and they'll say, I did something in 2018, and then they won't have anything else until 2020. So it will become a lot of back and forth at that time. The references, we've streamlined that. You only need 2 fellow references and your chief of surgery, who does not have to be a fellow, but they do have to be chief. You know, you just need 1 chief of surgery. Like I said, the biggest things is not filling out the application in chronological order.
There was a question addressed to me about how did it help me specifically as a medical student? And I would say as a medical student, that was probably some of the biggest initial benefits for me because of the networking. And so getting to know other members in the college. Also, as a medical student, I attended the Leadership and Advocacy Summit and got a scholarship to attend that in Washington, D.C. So they have different outreach things that you all can do. But I would say even just attending the meetings and the webinars and getting to know people, then they find ways that you can get involved in different committees. So it helps you strengthen your CV, your resume, as you're trying to apply for residencies. It can also help you network on ways to get involved in collaborative research projects and other things. So again, the networking really is key, because then you're going to find other people to help you get involved to help strengthen your application. And I have a medical student who conducts these interviews with me right now that I'm doing for our Pathways to Fellowship series. So, you know, getting a medical student involved from day one, that's what we want to do. So just get on the website, see if there's different committees that you want to get involved in. And if you have additional questions, you can always reach out.
There is a response from with regards to international surgeons who are looking to get in connection with other surgeons. For those that didn't see it, the International Relations Committee can also help international surgeons connect with their colleagues. They can help us have a relationship and build that reference. You can reach out to me, also our international team, Kathleen McCann and Tony Ortiz. You'll see their information in the Q&A section, their email addresses. Dr. Hiranyakas, I know that you're involved with your chapter now as the current president of the Thailand chapter. How has that helped you with regards to your engagement with the college, but also just growth as a surgeon, being involved with your local chapter?
Right. Thank you. It's actually a great opportunity to be involved in the local chapter, because I can broaden my connections to the other surgical disciplines, like my friends from hepatobiliary, pancreatic biliary surgeons, or even breast surgeons or bariatric surgeons. So we can now set up some more academic activities together and to join with the Royal College of Surgeons Thailand to promote the importance to become ACS member or even the fellow. So now we have a session as well for this year, annual scientific meeting in December for the Royal College of Surgeons of Thailand. We set up lots of multi-disciplines to talk about the advances in each of the field of the surgical fields, and I hope that this will be promoting locally to Thai surgeon as to know how important to become the member of the ACS. Thank you.
And Luca, Martha, are there any other questions that we did not address that may have come in? Please feel free to chime in. We are coming near the end of the 30 minutes in our webinar. This has been recorded, and we'll make the recording available to everyone that registered for the webinar. But before we do end, I do want to take the time to thank Corey, Karen, of course, Dr. Kilgore and Dr. Hiranyakas for participating on our panel today. And I do want to thank all the attendees for listening in on the webinar. We hope it was informative, and if you're not currently an ACS member, we hope it encouraged you to consider joining the college. As I said, a recording will be available, and we'll make sure to get that to all of you. Is there any last parting words from our panel before we ended? I want to give you a chance to say any last words.
No, I just can't emphasize enough how great the membership is in the college. I really don't see any downside whatsoever. So the world is your oyster. Join the college. You have so many things at your fingertips if you do, not only connections, but resources, tools to help you succeed in your surgical careers.
Great, thank you. So I'm going to stop the recording in shortly. We'll stay on for another 10, 15 minutes or so. So if there are any last questions, we'll be here to answer those. But I want to officially end the webinar, and thank you everyone for joining us.
Thank you. Thanks for having me.